Another top story tonight in Kingsport, where city leaders faced a sometimes angry crowd at a meeting about proposed changes to health care in the Tri-Cities. The Kingsport Board of Mayor and Aldermen invited Ballad Health executives to answer their questions and the public's questions about a plan to regionalize trauma care services. Ballad said care will improve if it centralizes care for its most critical trauma patients and newborns in Johnson City. That means changes in the level of care at Holston Valley Medical Center in Kingsport, where the hospital would lose its NICU under the Ballad plan. Also impacted Bristol Regional Medical Center. Chantel Batista is in Kingsport, where a called Board of Mayor and Alderman meeting was held earlier tonight. Chantel?
The called BMA work session lasted about 2.5 hours here in Kingsport tonight, and people had the chance to submit some of those questions prior to the meeting. However, by the end of the meeting, some in the crowd were yelling, and while some on the board expressed their confidence in Ballad's plans, others voiced their opinions.
You want to hear the truth. You want to hear the BS he's feeding you. I'm sorry.
Sir,
Yes.
seriously, I also
Many in the crowd made it clear they don't like the idea of centralizing the highest level of trauma and NICU care in Johnson City. People had a chance to submit questions before the meeting. Ballad Health CEO Alan Levine spent a significant amount of time representing Ballad's reasons behind their decision. He told the crowd the largest cities in America only have one trauma center.
And all over the state, this is how it's done. And we're not reinventing something new here.
None of the questions pre-submitted from the public were asked tonight. Mayor John Clark said he felt Levine covered a significant amount of related topics. Near the end of the meeting, one board member, Jennifer Adler, said she thinks Ballad should keep the NICU at Holston Valley Medical Center.
From the data I've read, from the things I've looked at, I would encourage you to maintain the NICU at Holston Valley as it is.
I think it's a straight up filibuster. I don't think any questions were answered except Adler's questions that she spoke up and raised.
I think we're all at a better place where we understand more than we did when we first walked in the door.
Units are trained for
Tonight's meeting ended without a vote. It's unclear if the Kingsport BMA will vote in favor or against it. It's also important to note that the state already approved Ballad's Trauma General Realignment Initiative, but the plan still needs to gain pediatric care approval from the state. Chantel Batista, News Channel 11 in your corner.
All right, Chantel, thank you very much. More than 38,000 people watched the live stream of this meeting tonight through the WJHL Facebook page. You can see a replay of that meeting on our Facebook page tonight.